to talk about the trends in India as well as the rest of the world, where you already have some European countries that are looking at a post-lockdown life, looking at how they can slowly begin to lift restrictions while you have the death rates going up in the United States. Joining us this evening, we first have Dr. Ashish Kamath from the Anderson Cancer Center in Houston, Texas. He's the author of a report that's being much talked about and read everywhere on whether those countries which gave us all BCG vaccines as kids, in those countries, whether we're actually seeing a slower rate of growth and slower mortality as far as COVID-19 is concerned. Really interested to talk to Dr. Kamath about that. Dr. Rajveer Purohit is from the Mount Sinai Hospital in New York. And we have Dr. Ramatkar Panda from the Asian Heart Institute also joining us here in India. Thank you all very much for being with us. Dr. Kamath, to you first. Can I just get your overall sense of where things you think stand in India at the moment? We had a graph that just showed us how cases have risen steadily after the lockdown was placed in India, particularly in the last week or so. Today is particularly crucial because it's day 14. How are you looking at India's trajectory at the moment?
So Nidhi, first of all, thank you for having me on the show. I obviously am not able to see your screen or the graph that you showed, but I presume what you're showing is that the number of cases has increased over the last several days and weeks. But if you are asking me how this would correlate with the lockdown and the social distancing that's occurring, I would say that if you hadn't implemented the lockdown and the social distancing, then the curve would be a lot steeper. And that's true of any country. So the fact that we're seeing flattening of the curve and in many countries a slower incidence of cases because measures have been implemented does not mean that we can get lax and take away those measures.
So would you be in favor of a longer lockdown in a country like India in particular?
So really, that is a question that I would defer to the health authorities in the individual country. That's more of a policy decision. And as a scientist, I always like to base my recommendations on fact and not speculation. And I don't have the inside numbers when it comes to the actual situation in India. So I would prefer to defer that question to the other experts who are on this call.
Dr. Panda, let me take that question to you. How are you looking at the numbers that India is dealing with? We're crossing our fingers, and when we look at the way COVID-19 has exponentially grown in other countries, the trajectory there, the number of fatalities there, you take a deep breath and you step back and you say, okay, maybe India's not doing so badly at the moment. What do you think, Dr. Panda?
I think before I answer that, we must understand that the COVID-19, there is no treatment. The only treatment hopefully will be vaccine, and that is months and probably more likely years away. And the only treatment available to us is a complete lockdown, followed by at certain point of time go for it with other measures like social distancing, hand wash and other things. So if you look at the experience of other countries, China took 60 days before they opened up. Italy, it is almost a month and still, they are just flattening out probably. So looking at that, good thing we started very early. So obviously you will see the numbers are going to go up initially. We are hoping that the numbers will start coming down, but I don't think we are expecting to come down within a week. So probably if you look at it as per the experts, if you look at the WHO guidelines as well as the CDC, and recently there was an editorial in New England Journal of Medicine. They also looked at talking about around 10 weeks to cross the curve in USA. So if you take all those experience, to me looks like it will be more than 3 weeks before we lift the lockdown. Because we have to understand there is no treatment. Only treatment available today is lockdown. Complete lockdown followed by gradual, moving away.
So what you're suggesting is that there has to be a complete lockdown at least till the end of this month, which may happen. But that's what you're suggesting, Dr. Panda.
Till how long I think will be determined by what we see next 1-2 weeks number of cases, and what the experts see analyzing those number of cases, like total number of new cases, number of infectivity. If you look at the transmission rate currently, it is more than 1. The curve to become flat, that means every person who is getting infected is infecting more than one person. For it to start coming down, it has to be below 1. to be really at a safe ground where you can really control, as per WHO, it should be around 0.3, 0.4. So I think there's a lot of factors for us to take into consideration before we decide to lock down. And also you have to understand that lockdown cannot be just overnight, we'll go back to what we have been doing before.
To be gradual.
It has to be very gradual, and the way of life have to completely change. We have to, because there is no treatment. The only treatment is lockdown, followed by social distancing, and all the healthcare measures you have to take, like hand wash, and all those things you have to do. So we have to maintain social distancing as and when even the lockdown is lifted.
Dr. Rajveer Purohit,
and it will be gradual. You cannot expect one day.
Sure, absolutely. I think that's why the government is also talking about a staggered lockdown. But Dr. Purohit, just to understand this from a layperson's perspective, which is that, is it in a sense inevitable that many people will end up getting COVID-19 because you can't sustain lockdowns forever? A vaccine is still some way away. Even if you gradually lift restrictions, at some point people will start moving out, people will get back to work, they'll go back to shops, etc. And we'll be doing more testing, hopefully. So should we be concerned by those numbers that show an increase in the number of infections, or should we be more concerned with the mortality rate and just the number of people who are actually dying from COVID-19?
Well, first of all, thank you for having me, Nidhi. America has just passed a remarkable milestone with this disease. As of today, more people have died from COVID in the United States than those who have died from than American soldiers in the Iraq War, the Afghanistan War, or 9/11 combined. So all three of these massive catastrophes to the American political body had happened. And in this first month of COVID, more people have died from this. I think we have to worry about both things. We have to worry both about the death rate as well as what's going to happen once we get coronavirus under control. And we still have some patients who are not immune to the disease, and some patients who may be asymptomatic carriers, let's say a month or 2 months from now. What's been a little heartening lately is in the last 3 days in New York State, at least, the death rate has stabilized from the disease. So we're seeing some flattening of the curve, and this has occurred because of these social isolation measures that we've undertaken. And I'm seeing it on the ground as well. At Mount Sinai, we're seeing sort of stabilization of the numbers of patients being admitted to the hospital, or at least the rate of increase of the numbers of patients being increased in the hospital and the rates of deaths that are occurring. And right now, we're still grappling with what will we do with our cancer patients, for example, a month from now or 2 months from now. Are we going to feel comfortable bringing them back into the hospital to have cancer surgery and potentially exposing them to coronavirus? And I think we haven't yet figured out those answers. One possibility may be to separate these patients into different parts of the hospital, but it's going to be an issue that we still haven't yet understood how we're going to grapple with going forward.
Dr. Kamath, just coming back to the report on those countries that have had BCG vaccinations. I mean, we all did it, having grown up in India. Now, since you actually brought this out, there's been a lot of debate on this report. But do you still feel that the evidence kind of points in the direction that you suggested, that there is a different trajectory for countries like India, where you have the BCG vaccine, and those that don't, like the US?
Absolutely. And let me tell you a little bit of the genesis behind why we embarked on that study. So there's a lot of evidence to suggest that BCG, which, as you know, has been used for tuberculosis as a vaccine, has also non-specific off-TB effects on the epigenetic immune markers in people. And there have been studies that have been done to show that it reduces mortality, not just in newborns, but also in elderly people that have been vaccinated. And this is attributed to increased resistance to Staph aureus, to influenza, to yellow fever, and to many other infections. So there's actually a study that's being embarked upon in the United States, which is going to be based in Houston and Boston, and it's called the BCG as Defense Against SARS, the BADAS study. And this is going to be to vaccinate people at the forefront, so the healthcare workers, the people in the ICU, the people taking care of patients first. Now, this is all based on observations and clinical studies and preclinical studies, but we wanted to actually explore as to whether this was actually reflected in the populations that are having a COVID incidence. And that's when we did the study to look at the different countries. And as you can see on the paper that we published, looking at 178 countries, there was a clear demarcation between the incidence and the mortality rates, almost a tenfold difference between those countries that had either an active or a recent BCG vaccination protocol compared to the countries that didn't. And this provided us with additional rationale to perform the trial. But as I said earlier, we always have to confirm observations with randomized studies. And that's why we're doing a small pilot randomized study here. If those results are clearly positive, then there's talk to expand it to the general population as well.
There are other countries, in fact, which are I think, doing trials as well and looking at this far more closely. Dr. Purohit, we just heard Dr. Panda there saying that even after a lockdown is over, all of us will have to change the way we conduct our day-to-day lives. Can you just sort of tell us, advise us on what that would entail, apart from washing your hands? Are we looking at a life where, you know, we, for the foreseeable next few months, maybe longer, we should avoid going to very crowded places, unless absolutely essential, keep our parents away from those places? I mean, what is the day-to-day change that you see in our lives in the next maybe year or so?
Well, it's going to be dramatic. And we don't know exactly how it's going to play out. Will there be mass testing of antibodies to determine who's been exposed and is resistant to getting the virus and not? Will we be separating those people out? And potentially, let's say if you're a healthcare provider who has antibodies, you'll be able to go anywhere you want in the hospital versus healthcare providers who don't have antibodies. Or let's say you're the public at large. I think these will be complicated policy decisions. There'll be definitely a change in the life for everyone. I don't think anyone's going to feel comfortable going out 3 months from now, even if the numbers of COVID patients have gone down substantially, without wearing a mask, without some kind of protection and maintaining distance. It may be that there'll be mass testing of antibodies to determine how comfortable you'll be going out in public. We won't go back to normal anytime soon, even after the immediate threat of illness and death is over. And I think 3, 4, 5, 6 months from now, our social lives will be radically different than they were 2 months ago, 3 months ago.
So you mean more masks, more social distancing,
Yes.
hand washing? People.
Absolutely.
You're right. People will probably be very wary and super careful. Dr. Panda, you think that would also maybe now, in addition to security checks at airports, we might have body temperature checks? I mean, we're already doing it, for instance, in our office. Every single person who walks in has their body temperature checked. I mean, is that going to be the new normal?
I think there will be a lot of new normal. Just like the way after 9/11, and the security in the airports completely changed, and we never objected to the degree of security checking that we go through today. The same way we have to completely change the way we are living. I think all, whether it's checking your temperature or not going to crowded places or even visiting a hospital, I think there has to be new norms as you learn. We are going to put new norms, and those will be the way of life. I want to give one more suggestion. I don't want my people in the country to become complacent, because I hope that what Dr. Kamath suggested, there is a good chance it is probably going to be effective, your BCG vaccine, but only a well-conducted study will show that. Till that time, we should not be complacent. The reason is there is a lot of talk going on that in India, the mortality rate is low. But if you really look at it, the reason why it looks low is because more than 50% of those who are affected, they are below 40 years of age. If you look at the people above 60 years of age, 63% of our total death in India is in that age group.
It's above the age of 60.
So we should not be complacent that BCG will protect us. Second thing, the currently number is very less, so we have got enough ICU bed for every critical patient. The moment we become complacent, the numbers goes up. There will be the number of patients needing ICU bed will be much more, then the death rate will go up. Let's hope that the BCG vaccine trial, if at all takes place, it will show that this probably going to protect. The only one what I see is going to really protect us will be a vaccine, which is probably 6 months or 1 year or 1.5 years away. Till then, the only treatment we have, again I am repeating, is lockdown, followed by gradual removal of all those lockdown measures, and us going back to those, not going back to our old habits, and practicing social distancing and hand wash and others.
Okay, but before we go, I just want to ask Dr. Kamath that while we are all going to listen to all the warnings all the good doctors have given us today, and we're not going to be complacent, can you give our viewers a positive message before you go? I think we all need to have some hope to hold on to, that, you know, we're not staring into some big black hole. So what is the positive message, if there is one? You don't have to lie to us.
There's always positive messages that can be had in any despairing situation. And I completely agree with what has been said. We cannot get complacent for sure. At the same time, it is very encouraging that the innate immunity that is conferred by the exposure to BCG, or a low-level exposure to even TB per se, and not just in India, in many countries, does confer on the population a baseline innate level of immunity. That being said, as has been mentioned before, we can't relax on the social distancing and the lockdown, but we can hope that the trials that are being done, as you mentioned, some of the countries were able to get it up and going even quicker than the US, will provide us with sufficient data to at least allow us to use an existing vaccine before a coronavirus-specific vaccine will be available, which unfortunately does take 9 to 12 months. So the positive message there is that there is probably a benefit that is conferred upon the Indian population by the BCG vaccination. We shouldn't get complacent, but we can hope that the results of the trials that are being done will support this observation, and then we can roll it out in a more controlled fashion, even in India.
All right. Well, thank you very much to all of you. Thank you for all that you do. You're the good doctors, as we said. Clearly, the next week or 10 days are going to be crucial for us here in India, for all of you in the United States as well, and other parts of the world. Let's see how things go over the next week or so. Thank you very much to all of you for joining us.